And thank you again for being here. Today we will be hearing from two experts in the field of forensic services, and we'll be getting a nice overview of what those services include. Um, we have a partnership here for today's training between the San Diego DV Council, One Safe Place, Rady Children's Hospital, Chadwick Center for Children and Families, and Palomar Health Forensic Services. So we've got 130 people in the audience today, a very nice broad audience, as we often have for our DV Council meetings with social service, child and youth services, mental health, justice, and other services. Thank you again for taking the time to attend. We see you as doors of opportunity where you can help connect survivors to services, families to services, and having that background is really helpful. Just a little housekeeping. So please put all of your questions in the Q&A section of Zoom. There's a chat and there's a Q&A. Preferably put all your questions in Q&A. And then we will be posting some resources as the speakers are talking in the chat section. So you want to check that as well. All registered attendees will be receiving the resource links by email. Also, as a follow-up, we won't be sending the PowerPoints, but we are recording today's training as well. So if you want to rewatch it or share it with a colleague who missed it, you'll have that opportunity. Also, we'll be sending certificates of attendance within 10 days of today's training, so you'll get that as well. So to welcome our two speakers, we have Michelle Shores, who is a Director of Forensic Health and Trauma Recovery Services for Palomar Health. She's a forensic nurse examiner and the Director of Palomar Health Forensic Health Services in the Trauma Recovery Center departments for Palomar Health, which provide comprehensive specialty program services for those impacted by violence. Forensic Health Services is the centralized provider of medical evidentiary exams for adults in San Diego County and is the North County San Diego nationally accredited Child Advocacy Center and Family Health Services. Forensic Health Services operates the one hospital-based training center for forensic medical exam training known as the California Clinical Forensic Medical Training Center, CCFTC. Michelle has almost 20 years of nursing experience and is a certified emergency pediatric sexual assault nurse and a certified adult and adolescent sexual assault nurse examiner. We also have Dr. Nienow with us, and she's an associate clinical professor of pediatrics at the University of San Diego, the division chief of the Child Abuse Pediatrics of UC San Diego School of Medicine, and the medical director for the Chadwick Center for Child and Families at Rady Children's Hospital, San Diego. As a child abuse pediatrician, she often provides medical evaluations for children who are alleged victims of all forms of child maltreatment. Dr. Nienow frequently serves as an expert witness in civil and criminal legal proceedings related to all aspects of child maltreatment. Dr. Nienow has conducted research in patterns of disclosure in child sexual abuse, as well as methods of testing for sexually transmitted infections in children, and has co-authored publications on both topics. Welcome to both of you, and I'm going to stop sharing so Dr. Nienow can jump on. Welcome.
Thank you so much. Sarah, can you see my full screen on your end?
Yes, thank you.
Okay, perfect. Good afternoon, everybody. Thank you so much for taking the time to join us today to learn about pediatric forensic services. I wanted to give you a little bit of background about the pediatric services here in San Diego County. In San Diego County, we those of us who are professionals who either investigate, evaluate, or treat children who are potential victims of abuse, neglect, or witness to violence, all of our services are kind of dictated or fall under the umbrella of the victim witness protocol. This protocol includes all children who are under the age of 18, so both young children as well as adolescents. And it provides a trauma-informed, developmentally appropriate, and victim-centered experience for child victims of abuse or neglect. It also helps us to promote consistency, communication, and coordination among the multidisciplinary partners so that families and children receive the best services possible. The reason that we do this is not only historical, but also national. So the multidisciplinary team process began in 1985 in Alabama with a district attorney who is a former congressman there. He recognized that the social services and criminal justice systems were really not working together when child abuse cases were coming through. So he designed this process such that a variety of disciplines that interact and coordinate their efforts are able to do so kind of under an umbrella of this team kind of dynamic. This allows enhancement and improvement of the response to child maltreatment and prevents some of the issues that we saw in the mid-1980s involved in child abuse investigations. So this is a national process. There is a national accreditation body called the NCA that does provide standards that we have to follow as children's advocacy centers and MDTs across the country. This is what the MDT process looks like. So it brings together not only our CAC or Children's Advocacy Center professionals, which include medical professionals, forensic interviewers, family advocates, and mental health professionals, but also our community partners. So that's child welfare services, our DA's office, county council, law enforcement, and people within the school systems to kind of come together to lift up the kids and families that we see. So I thought I would play this video for you that kind of explains the CAC process. This is published by the National Children's Alliance, that NCA accreditation body, and it tells why this is important.
Advocacy Center, or CAC, provides support to victims of child abuse. Without a CAC, an abused child may have to tell their story over and over again in settings that may be scary or where kids may think that they're in trouble. Then, families have to search around for the services their children need, all on their own. But in a CAC, a child tells their story to a trained interviewer who makes the process gentle on the child and finds the facts which are crucial to the child's case. Then, a community of professionals in medicine, law enforcement and child protective services, prosecution, victim advocacy, and other heroes work through the CAC to decide the best way to help the child. And CACs provide science-backed mental health care that heals kids from trauma and helps them reclaim their futures. This community of caring professionals rallies around the child so children have everything they need, all in one place, at the CAC. To find your local CAC or a children's advocate.
So that kind of goes over the CAC process and why a CAC is important. What's also important to understand is that in California, there is a statute in the California law that provides that counties use a children's advocacy center to provide this multidisciplinary response and child-focused services. So not only is this important on a national level, this is also important from a state level, and here in San Diego County, a local level. In San Diego, there are 2 children's advocacy centers that are kind of divided up based upon location of where the child lives. We use the location where the child lives so that they end up being close to the location where they're going to receive all of their services. Sometimes children will be down at Rady Children's Hospital, but they live up in Poway. And so then we will refer them to have all of their services done at the North County CAC as opposed to the Chadwick Center so that they can be close to home and continue their services for the duration that they may happen. So this dark line that runs along the 56 and all the way out to East County is where we kind of separate how service provision is done, with the Chadwick Center being our central and east and south counties, and then North County, which tends to have larger geographic scope, being taken care of by our CAC at One Safe Place. So Rady Children's Health Services building on Kearney Villa Road is where the Chadwick Center is located. It's about 3 city blocks from the hospital proper, and we're located on the entire 5th floor of that building. And One Safe Place is in San Marcos in a really shiny, fancy, beautiful building. Not that I'm at all jealous. So there are 2 locations where our kids can get services. CSE services that are provided at both locations include acute sexual assault exams, forensic interviews, CFTSI, which is child and family trauma symptom short-term therapy. This is a dyadic program that works with both the child and their caregiver to help recognize and respond to trauma symptoms as a result of their sexual abuse, physical abuse, or witness to violence, and then long-term trauma counseling services. On a limited basis, non-acute sexual abuse evaluations are also provided up at the North County CAC, and they're also provided down at the Chadwick Center CAC on a more broad basis. Down at the Chadwick Center is where all physical abuse exams, drug endangerment exams, neglect, and medical child abuse exams are located. That's where all of the child abuse pediatricians are housed, to include Dr. Nicole Eisen, who is the medical director up at the North County CAC as well. So that's where the physicians tend to be housed. So we have most of our clinic for physical abuse down here. Forensic interviews are imperative to the pediatric process. It is a national standard that children who have been abused have forensic interviews prior to any medical exam that is necessary. This is so that the child can be seen in a safe, supportive, and neutral environment in order to allow them to better tell their story. When we don't have the CAC process in place and forensic interviews are not utilized, a child is on average asked to tell their story 15 times. So that's 15 times that the child has to decide, is this person safe enough for me to tell my story and to provide that story? So utilizing forensic interviews and the CAC really helps to reduce that number of times and to reduce the amount of trauma associated with talking about your victimization. Despite the fact that the child abuse pediatricians are located primarily at Rady Children's Hospital, we do provide consultation to medical professionals throughout San Diego County and the surrounding regions. That's for children who are admitted to all inpatient services at Rady Children's Hospital and the UCSD burn unit, so we can see those children in person at those locations. For children who are not admitted to Rady or UCSD, we will provide interprofessional consults. So that's consults over the phone with providers at all of the other medical systems within San Diego County. And then outpatient consults are when we go to the emergency department, and that's done primarily at Rady Children's. Both our clinic at the Chadwick Center and the clinic at One Safe Place function on a business hour kind of time frame. So we have scheduled appointments for outpatient clinic patients Monday through Friday, 9 to 5. We are not open nights, holidays, or weekends. We do have 24/7 response for acute sexual assaults in both locations for children who are in our geographic regions. So there's never a time where kids cannot get access to an acute sexual assault exam because those are time sensitive. It's the other examinations that are not emergent that we schedule on an outpatient basis. So that's kind of the services that are provided by each location. What's important to understand is, how do you respond as a professional in the community? What do you do if a child makes a disclosure to you? First, it's really important to understand what a true disclosure looks like. So true disclosures are spontaneous statements made by a child without prompting. So that's anything the child says to you that isn't in response to a question about abuse or neglect. So statements such as like, grandpa hit me with a belt, or Joey touched my private parts. Those are spontaneous statements and do constitute true disclosures. Other factors in which we may not have a disclosure but are indicative of abuse are acts that are caught on video, photos of children in states of undress that are found on phones of adults, suggestive texts between children and adults to which children cannot consent, witnessed events of abuse, and things like patterned injuries, which are diagnostic of physical abuse, but may not have a disclosure associated with them. When a child discloses to you, your reaction really makes all the difference in the world. So our motto kind of in the forensic world is start by believing. So it's really important that you respond to the child in a way that shows that you believe what they are saying and you're going to support them and get them the help that they need. When children don't think that they're believed, they will stop disclosing, which may mean that they will be repeatedly subject to whatever maltreatment is happening. So the most important thing is, if a child starts to make a disclosure to you, don't interrupt them. So trauma makes your memory behave in a different way, such that if a child's narrative is stopped, they may not be able to pick up the narrative where they left off. So we want to make sure that people aren't stopping children from talking when they decide that they want to talk. It's also important that you listen without showing emotion on your face. Kids are prone to believing that what you show on your face is how you feel about them. So whether this is making you sad or angry or disgusted, not having that emotional response is really going to help that child continue to make the disclosure and not to infer that you feel like they are doing or saying something wrong. We also want you to document statements word for word or verbatim to the best of your ability. So if a child comes up to you and says, "Hey, Joey touched my tutu," we want you to document "Joey touched my tutu" as the disclosure that was made to you, not "Joey touched the child's genitals," because the child didn't tell you that Joey touched their genitals. The child gave you a different statement. So we want you to write down that statement verbatim. We also don't want you to ask questions of children about their disclosure unless you've been trained to do so. It is very common that problems happen when people ask questions inappropriately of children. This happens very commonly when children are questioned by family members or people who don't have training on how to do this. And there really is a wrong way about how to ask questions for children that can profoundly affect the investigation into the abuse that the child is disclosing. And those negative effects can prevent the child from ultimately being safe. So some ways that questions are poorly formulated include asking loaded questions. So loaded questions is the most common problematic way that people ask questions of children. Loaded questions contain unjustified assumptions. So that's questions like, who touched you there? The unjustified assumption is that the child was touched, even though they didn't necessarily say that. So the typical scenario is a child complains of genital pain and somebody asks them, "Well, who touched you there?" That implies that the child's pain is related to touch, which the child did not say, and it forces them into giving a name. And so that statement that is elicited from the child can't be adequately interpreted and doesn't constitute a true disclosure, and that can make things really difficult later on for the kiddo. Leading questions imply a particular answer. Things like, "Are you afraid of your dad?" which implies that at some point you should be afraid of your dad. Or, "Did someone hurt you?" suggestive questions suggest that a certain answer is correct. So that would be things like, he didn't hurt you, did he? And shaking your head no. And so then the child is, and it is implied what the child should answer, and the child will often offer that answer even if it is incorrect. So we want to make sure to avoid inappropriate questions. Forensic interviewers are the way that we do that. And so when a child makes a disclosure to you, really the takeaway point is, when you don't really know how to ask questions of children, just don't. That can be taken care of by the investigators in the case, who will refer a child to the forensic interview and the CAC, and we can get them all the services that they need. If a child discloses to you, then obviously we want you to make a report. So we want you to report anytime you have a suspicion of abuse or neglect of a child happening. Anytime a child has an injury consistent with an assault, to include those patterned injuries I talked about earlier, and anytime a child clearly does not have their basic needs met. So children reporting to you, you have a suspicion, or the child has some sort of outward sign that abuse may be happening, then we want you to report. The key here is that you only have to suspect that abuse is happening. Your job is not to investigate the abuse and prove that it is happening, merely just that you have a suspicion. Many people are hesitant to report concerns for abuse because they're afraid that they may be wrong. If you're wrong, that is completely okay. One, you're protected by law. So as long as you made that report in good faith, you are not going to be held legally liable and won't be sanctioned for that. All reports are confidential by law. So nobody's going to go to a family and say, hey, Sharon reported you for potential abuse. That cannot happen. It has to be confidential by law. And really, it's not a punitive system. So if you're wrong, nothing happens, the case gets closed, everybody moves on. The biggest issue is, what if you're right? So if you're correct and a child is being maltreated in some way and you fail to report, then they're going to continue to be harmed and eventually could end up having lethal force used against them. If you suspect abuse or neglect is happening and you don't report, you actually can be held legally liable for that. There's statutes in every state about the punishment for failing to report abuse. So that's really important as well. The reasons that we want reports to happen for child maltreatment is not only to protect the child, but also to protect other children that are within this child's sphere. So whether it's other children in the home, or whether it's a professional out in the community that has access to other children that's perpetrating the abuse, all of those other children are potentially affected, and we want to make sure that they're safe as well. And honestly, the biggest and best thing that we do as a system is to provide resources and support to help families become healthier and safer. So the purpose of this is not only to protect the child, but to kind of lift up these families, give them the access to services that they need, and to provide them support so that they learn how to be safer together. Many people ask, well, should I tell the family that I'm reporting? I tell the family 99.9% of the time, every time I'm going to make a report. It is best to be upfront and honest about your mandate to report abuse or neglect. Like, I am legally bound to do this. This is in no way me saying that you did something to harm your child, but this is how we protect you and we protect your child. Families tend to be much happier and satisfied when you are transparent with your mandate to report and that these things are going to happen. When they're blindsided, when investigators show up to their house, that's when things can go awry. That being said, you are not obligated to tell the family. So there are statutes that support that if you think that disclosing this information to the family will place the child at risk of harm, then it is better for you to not tell the family that you're reporting. So that is the one and only circumstance in which I will not tell the family about my reporting of suspected abuse or neglect. So let's talk a little bit about the investigators involved in the child protection system. There are two investigative entities primarily, and that is CFWB, or Child and Family Wellbeing, and law enforcement. So the role of child and family well-being is not only to assure that the child is safe, but to also investigate the home and make sure that all children within that household are safe and that the family members have access to all of the things that they need to be a safe and healthy family. So do they have appropriate shelter, appropriate clothing? Do they have food available in the house? Do they have education and knowledge about how to appropriately handle behavior modification? Child and Family Wellbeing's goal is to maintain the family together as a unit. So we want to keep families together. We just want to make sure that they're safe when they do that. Child and Family Wellbeing investigators can assure that children receive those forensic interviews and medical exams and also therapy as appropriate. So once a child enters the CAC world, we kind of bring them from that acute victimization to the survivor role and take them through the entirety of the process. So Child and Family Wellbeing's role is safety and health of the family as a whole. Obviously, that is different than the role of law enforcement, whose job is to investigate criminal aspects of a case. So is there a crime that has occurred? So if a child has been beaten and has injuries, then there is a crime that has happened. If there is no crime, then no legal crime, then law enforcement won't be involved. So that involves things like child accesses marijuana products in the household and ends up in the hospital. So that's not a crime to have those products in the household, but it is a safety concern for that household. So then we'll involve Child and Family Wellbeing, who can provide lock boxes and cabinet locks and all of those things to make sure that the child doesn't have repeat safety issues. And law enforcement wouldn't be involved, again, because there is no crime. So law enforcement ultimately submits cases to the district attorney, who will review those cases and potentially prosecute if there is a crime involved. So then it's important for us to understand, as people who are not part of Child and Family Wellbeing or law enforcement, what our role is. And really what we want you to understand is, as a professional who may have contact with children, if you have a suspicion, please report. For the Children's Advocacy Centers, we don't take walk-in cases for medical evaluations and forensic interviews. There is a standard process across the nation for how children access the CAC, and that's through investigative bodies. So law enforcement and CPS will get kids into the CAC system. So your primary role is to do that initial report, and then the investigators can determine what's the next best steps for this child. Does this child need to have an acute medical exam? Does this child need to have a forensic interview before they have a medical exam? And all of that can get sorted out once that multidisciplinary team process takes place. So that is it for my part on the pediatric services that we have here in San Diego County and how important those are for the kiddos of our county. I'm happy to answer any questions that anybody has about the pediatric process before Michelle gets started, or to answer those at the end should they come up.
Right now, both the Q&A and the chat are crystal clear. I think your summary was so spot on and beautifully put and really clarified a lot of what's going on in the county and what the resources are. But if anyone does have any questions, please feel free to put them in the chat or the Q&A. We can monitor both. And if not, we will hand the reins over to Michelle to learn more. Okay, we see our first question coming in. A question from Kathy Zamora. Can you please talk about when a child discloses about abuse and it was not a recent incident? What would that process look like?
That's a great question. And really that encompasses most of the children that we see. So most children who have some especially with sexual abuse in particular. So children who are victims of child sexual abuse often have delayed disclosures, meaning that they don't tell immediately after that event has happened, and they often don't tell for very prolonged periods of time. One of the things that I have studied pretty significantly is the average time to disclosure. And in my efforts, we found that the average time from the first abusive event to the child first tells somebody is 2.5 years. So it's very common for children not to disclose immediately following their abuse. And so when we talk about child sexual abuse specifically, what would happen in those cases is it would get reported to investigative bodies. And those investigative bodies would get the child to a forensic interview to obtain their disclosure about what happened. And then the child would go to medical services to have a medical exam. All children who disclose sexual abuse deserve to have a medical examination. They often feel like they're somehow marked, scarred, or different. And so one of the primary things that we do is to help reassure them that their body is healthy and normal. And that really reduces a lot of trauma. You can actually watch the child's demeanor change when they come into the medical exam and they think we're going to tell them something's wrong. And then they walk out and they know that they're okay and people can't tell that this happened to them. It's really healing. And it's one of the ways that we can help reduce some of that trauma so that they're not acting out in ways that are potentially unsafe. And then we get them into those trauma services. For physical abuse, that tends to be mostly our younger kids where somebody notices injury on the child's body and we don't really have a disclosure in many of those cases. But in any case of a child's disclosing injury, so physical abuse injury, witness to domestic violence, being driven in a car by an intoxicated adult, we would still recommend that you all report that to Child Protective Services or Child and Family Wellbeing, which they're now called, and then it will get investigated and the next best steps will be determined. So we do provide forensic interviews and exams to people with intellectual disabilities. That's actually one of the primary reasons why forensic interviewing is important, because every interview is catered to the developmental level of the child. And depending on that developmental level is what we can expect to get from the child. Complex concepts like time are very difficult for younger children and children who are developmentally delayed. So that's not information we're going to try to obtain from them. From a medical standpoint, we will actually see developmentally delayed adults if they're primarily nonverbal for their evaluations as well, because it works a little bit differently than an adult evaluation would. But every forensic interview is tailored for the developmental level of the child. Obviously, if we have children or adults who are nonverbal or minimally verbal, a forensic interview may not be able to be done. And then everything kind of rests on what is found out during the investigative process and or potentially any injuries that are found on physical exam.
Thank you. There's also a question that came in, just better trying to understand funding. How are child forensic exams funded, just broadly, generally, the concept?
Good question. So that really depends on jurisdiction. Here in San Diego County, it's funneled through law enforcement, but ultimately it's victims of crime funding that comes federally. So the federal government provides a pot of money to entities, so usually states, and then the states divide it up to be used to fund services for victims of crime. So children or adults who are victims of crime should not incur any cost associated with services related to that crime. So we don't charge families directly for any of the services that we provide. And it's a fee-for-service structure here in San Diego County. So forensic interviews are billed for to our investigative agencies, and it's that victims of crime money that kind of is funneled through the county that ultimately pays for that. Some of our other services are grant funded, so things like short-term and long-term therapy. And then on the medical side, a lot of children that we see with physical abuse injury are going to be seen at the hospital proper. And then that is just part of like the hospital service that they get. So it's not like a separate billing structure. I hope that made sense.
Absolutely. Thank you so much. All right. Please feel free to keep putting questions into the chat, into the Q&A. We are still monitoring both. We'd love to let Michelle Shores take over now and share what that process looks like for adults.
Okay, can you hear me? We're good?
We're good. Thank you.
Well, thank you so much. So are you able to see my PowerPoint?
Yes, ma'am.
Yes.
Okay. Well, thank you, Dr. Nienow, for that presentation. And a lot of the principles that we're going to be talking about translate between children and adult services. So I'm not going to, I'll reiterate some aspects, but I'm here specifically to discuss the adult services we have in San Diego County. So again, my name is Michelle Shores. I am the director for the Forensic Health and Trauma Recovery Center with Palomar Health. And we're going to go ahead and get started. So again, some of the topics we talk about today are, brief but heavy. So just, I always want to put a plug in there for making sure those that are caring for some of the most vulnerable populations that, making sure that you're finding a way to charge your batteries as well. And this is just a quote that resonates with me, being in my background of emergency and forensics is there comes a point where we have to stop pulling people out of the river and we need to go upstream and find out why they're falling in. So a lot of the services are intended, right, to provide not only that intervention with the direct services, but also to hopefully have impact, right, on an individual's life and well-being by empowering and promoting that journey with a team of professionals. So what exactly is forensic healthcare? It is the intersection between healthcare and the legal system. We always lead with health first. So medical is first, and it just so happens that all of our professionals are highly trained at the ability to be able to speak to the process if there is an intersection with the legal system as well. So just again, between the Child Advocacy Center, the Forensic Health Services Center, what we're working with is those that have experienced trauma in some form of fashion. It may be polyvictimization, sexual abuse, domestic violence, but ultimately we know that it can be physical, spiritual, as well as psychological, generational. And our job is to make sure we have services or interventions in order to help treat that trauma. And again, we talk about trauma, at least in the medical field. It's common to say I'm a trauma nurse or I work in trauma, and that means something, that connotation means something very different. Like you're working with someone that maybe have experienced a car accident or some sort of other violence. But in reality, trauma has an entire spectrum. And all of us as multidisciplinary team members have the chance to intervene and to connect to the next level service. So as Dr. Nienow shared, Palomar and Rady have been in services with children, serving children since the 1980s. In 1991, Palomar Health began operating out of Poway for the sexual assault response team. And then in 2017, we also were able to add additional services beyond sexual assault to include domestic violence, elder abuse, human trafficking, gang violence. So again, really expanding our services to be comprehensive and serve whatever our community needs us to provide the forensic medical exams for adults. So again, I use these concepts of what happens without a child advocacy center or a multidisciplinary team response, that there can be poor outcomes. So utilizing the right specialty, the next level specialty, and knowing your roles is important. So Forensic Health Services provides 24/7, 365 response from the medical team to serve acute medical exams. So we have 2 to 3 nurses on call 24/7. We respond to sexual assault, acute sexual violence, domestic violence, elder abuse, human trafficking, gang violence. Dr. Nienow spoke about our child advocacy process, which we have our team of forensic interviewers, our medical team for acute and non-acute pediatric exams. And then we also have our trauma therapy services located at One Safe Place and that serve San Diego County. Additionally, if you'd like to know more about forensic medical exams and how to receive training, you can look at the ccfmtc.org through Palomar Health, which we provide training to medical professionals on performing forensic medical exams. So the adult services in San Diego County, we do have 2 military adult programs with Camp Pendleton and Balboa. And then Palomar Health is the centralized adult service provider for forensic health services in San Diego County. We have multiple locations. We have highly trained specialty nurses that respond, who have been working in this field for a long time and have expertise, because again, this is a very complicated part of medicine that stands up, the training experience stand up in a court. There are multiple locations. One is One Safe Place, which is the Family Justice Center located in North County, San Diego. We have 3 medical rooms at that location. We also are at Your Safe Place, which is downtown Family Justice Center. We have a location in Poway. We have a location in Santee and Chula Vista. Rady and Palomar provide support to each other night, weekends, and holidays for acute exams. And then Palomar Health can also respond to if someone's unable to be safely discharged from an emergency department or an inpatient unit or other. We also may triage and respond to an outpatient location. So multiple opportunities throughout the county with an expert team to ensure that we respond within an hour of being notified. Dr. Nienow already spoke to our Child Advocacy Center locations, covering both north and south and all of San Diego. And then she also touched a little bit on the multidisciplinary team process. So where do you come in that multidisciplinary response, and how you may let a patient, or I say patient because I'm a nurse, but somebody who's experienced violence know about these services. I think it's important to understand the protocols and the pathways in San Diego County, knowing that clear communication, reducing the number of times somebody might have to tell their story is important, and getting them connected. So for the sexual assault response team, we have a sexual assault response team standard that we operate under, an MDT standard. That link is posted in the chat. There's also guidelines in that of what a community could do if somebody arrives to a hospital or they're not sure how to manage. A majority of our patients that we see for sexual assault may arrive to an outpatient clinic or an emergency department if they're not sure where to go. But most of the services do not need to be handled in the emergency department. So it's important to know the protocols, to know the screening, and to know who to call. So again, understanding that if somebody comes in for a sexual assault and it's been 2 weeks, that as an adult, that might not be somebody that would receive a forensic medical exam. However, they would need resources, may need medical treatment. Knowing where somebody who's experienced DV or strangulation, that may or may not require evidence. So it's important to know who to call. And our team is available 24/7 in order to help you navigate some of those questions. The CARES acronym we use a lot in our domestic violence protocol, but it really translates across all aspects. Do you have a screening process? If you do, what's that screening process look like? Are you, if you're sitting with somebody as an advocate and they report strangulation, do you notice that they're struggling to breathe? Are they having any symptoms? In that case, what's your process? That might not need an emergent forensic exam. That might need to be somebody who's going to a higher level of care, such as an emergency department. And then knowing your reporting status, especially on the adult side. There are processes for adults where if somebody has experienced a sexual assault, that they may have what's called a non-participating report, which is an exam that we can conduct. It still will have to be reported, but the patient doesn't necessarily have to engage in law enforcement. So that process is for those that are undecided of what they would like to happen after the exam. A majority of our exams, though, come in by the traditional manner of law enforcement, that law enforcement has contacted the forensic team and we all dispatch to one of the centers. And then just knowing, making sure that person is connected into services. One thing to remember is that if you don't know, it's okay, just call. Both Chadwick and Palomar have 24-hour forensic staff on available to help triage questions. But in general, for an adult, the time frame where we would see someone for a sexual abuse exam is about 120 hours, unless they had significant pain or bleeding. For kids, it's a little bit different. So, those timeframes may be based on last contact. So again, that's why just report and let those that make those connections for children take place. But if you're sitting with an adult and they report that they feel that something might have happened to them, they are concerned, or they make a shared a disclosure, I think it's important to take the time to say, thank you for sharing that with me. Would you like me to contact someone to talk about options for having an exam? If you are an advocacy agency that provides those services, you more than likely have that information available. We also have information that we're going to post in the chat around the Marcy's card. Again, sexual assault in general is about 120 hours after the potential event for evidence collection. But for DV or strangulation, there may be longer time frames. Whereas somebody, if they reported assault of head trauma, physical abuse, other strangulation injury, the forensic exam may be conducted beyond that 120 hours. But for sexual violence, it's really the 120 hours is based on the state and local protocol. So different types of exams. We, again, perform victim exams, both acute as well as suspect exams. Suspects exams are conducted at specific location. Because we are the medical neutral party in this process. We also, again, non-participating reports that somebody can have an exam and then decide what happens when they're ready to engage with law enforcement. But GAFEs they do not only have to have strangulation to have a domestic assault forensic exam. It's important to connect them to a domestic assault forensic exam. However, it does not only have to be strangulation. It can be physical, reported physical assault. So if you're with someone in the clinic and they want to know a little bit more, one, I would minimize, especially if you're in a healthcare facility, follow the protocols. You're not wanting to do clean catches. You're not wanting to do additional testing until you've determined if they're going to have a forensic exam alongside with law enforcement. Two, I would hold off on potentially changing clothing, potentially having providing food or drink until you've connected with a provider to know, are they going to have an acute exam? Because that those are typical items that we use for comfort in the field. However, if somebody's going to have a forensic exam, that may be counterintuitive or counterproductive to us potentially retrieving any evidence. So if somebody discloses, this first step would be determine if you're a mandated reporter to perform that assessment. If you're not and you have questions, you would call the forensic facility and talk to one of our nurses who can help guide, or refer to the county protocol or victim advocacy agency. So once that person is determined that they would be willing to have an exam, the nurse will let the patient, law enforcement, and the advocate know where we're going to meet. We meet on site. The process takes about 2 to 3 hours in general. We would have a brief interaction with the patient. They would meet with their victim advocate. We would again then go through our standard process. So another part to remember are these exams are consent-based. So a big part of our process and why we don't recommend those in the field trying to maybe explain the process is get them connected to a forensic nurse or a forensic healthcare provider. We go through all the options of consent with them. Informed consent is a very important part of this process. These exams are consent-based. They cannot be forced or mandated onto anyone. They cannot be ordered. If somebody is unconscious or unable to engage or consent, then these are not medical necessity exams. We would not perform that exam until a person could consent, unless we are compelled under warrant. So again, it's really important to know that these are consent-based exams. The age of consent for a medical evidentiary exam is 12 and older. But again, this is something that is an interactive process with the healthcare provider. We, victim advocacy and case coordination is a very important part of the process. We all have our roles. So again, our victim advocates through the CAC or our community-based advocates play a really important part in that multidisciplinary team rapport building and process. And they can help provide some of that information around system navigation and empowerment. There are the Marcy's card or the Victim Bill of Rights is available through San Diego County. I think there's a link also in the chat. So it's important to have some of those on hand or to be familiar with the Marcy's card and Marcy's law. Remember, we are medical mandated reporters. And so even for adults, we would let the patient know that everything that we discuss, there may be elements that we do have to report. And that is around suspicious injury, which again, reporting of sexual assault, domestic violence is considered a suspicious injury. But that is something that we spend time talking to that patient about and delegating the roles. The exam itself is a focused exam. We're doing using standardized forms, a standardized process. We would detail the report of the history, ask some clarifying questions for the adults. We would go through evidence collection, if applicable, forensic photography, crisis intervention. We use standardized forms, a standardized process to document, and the form itself is also considered evidence. If applicable, we would collect forensic evidence depending on the history. Again, this is something that is part of the process and the patient consents, and then that evidence gets submitted to the crime lab. We also document injuries, injury identification, understanding, with or without a history, what may be the mechanism of injury. We assess for strangulation. We look for signs and symptoms, as well as document, because many patients refer to choking, but choking and strangulation are different, and it's definitely something that we would want to get a detailed history on during the forensic exam, as well as any potential photography. Again, forensic photography happens throughout the medical evidentiary exam process that is consent-based, and these go through a standard process and are submitted as part of the evidence. And then just a reminder that sometimes patients have a history, but they may not have visible physical findings. And so if someone reports strangulation or an assault, we document that history, but that patient may not have visible findings or even findings that can be photographed. So we're looking for symptoms as well, such as headache, blurred vision, nausea. So we go through, again, a detailed focused history and then a physical exam. We also work with the patient and will conduct a danger assessment. We use the 5 danger assessment because there's a lot that the patient would go through with us. And so that follow-up would happen later on with their assigned victim advocate. And just to, San Diego County and San Diego County Domestic Violence Council, I think this has been really important, but just by adding a forensic nurse into providing services additionally outside of sexual abuse, but for domestic violence, elder, and services, we have, again, our process is medical, and it helps inform the decision. And being able to look at some of the felony filings that have happened as a result, because a lot of the times, as I stated, there may not be visible physical findings. However, there may be symptoms that person has experienced. So just being able to educate the court on that medical process has been important. Everything we do is based on penal code. I do have to give a shout out to San Diego County for taking violence serious, making sure that the public is aware, making sure there's processes in place, things like the KHAN that was issued around domestic violence being a public health issue. The California law has changed as a result of what has happened in San Diego County. How it was handled, how sexual violence exams were handled during COVID. And then just another point to bring up is once they're connected to the forensic nurse or the forensic health services, we also work to get them connected to case coordinators, advocates. They get referrals into short-term trauma therapy. And as Dr. Nienow stated, everything we do not bill the patient for anything we do. So we, again, all of our services are funded either through law enforcement, grants, or community donations. So the patients never receive a bill for anything we do. And every year we place a pinwheel on the lawn to represent come in for awareness. And then here are some numbers. We have our we have a 24/7 after hours number that is available at 888-211-6347. And if you have any questions or just not sure, our healthcare providers are available to help guide you into the next steps. And then we also have our business number as well as Chadwick's. So similar to what Dr. Nienow said, majority of our services for children, they come by the way of child family well-being or law enforcement. For adults, these exams always have to be reported on from our side. But if you're a community advocate and someone has reported sexual assault, strangulation, call and the nurse can help you guide to the next steps or even talk with that patient. So I know that we are at time here and I'm happy to answer any questions as well. I'll leave this slide up for numbers just in case.
Thank you so much, Michelle, for sharing so much about not only how to access these services and their purpose, but all of the ways in which San Diego County is really unique and moving the needle. That's so interesting and helpful. Right now, yet again, our chat and Q&A are pretty empty. So I just want to take the time to invite if there's any follow-up questions for Michelle.
Yes, for either of our panelists, if you have any questions, please put them in the QA or in the chat.
All right.
Is that for the so I see a couple questions. You want me to answer that one first one, Sarah?
Yeah, we see, the public health nurse. As a public health nurse, how can I support your team as a person who isn't trained forensically is that first one.
So I think that the biggest step is knowing that what the relationship public health nurses may have with the community is really important. And I understand from the forensic team what role that you have as a public health nurse. So I feel like knowing that the right level of service at the right time. So when you do have a concern or a disclosure on the front end, knowing how to say, would you be okay with us connecting, right, with a partner, right, messaging, connecting with a partner who may be able to provide us some options, or that, having a nurse talk with you about what some options are. So leaning on those experts, just like I would for you, for the public health nurses. So once we have completed our process, if there are additional services that need to happen after the acute exam phase is done, about us getting consent to connect back right into a public health setting. So I think it's how we utilize each other's specialty in that. And Dr. Nienow, I don't know if you have any more to add around public health. It's really just about, if the way I look at it is that right specialty at the right time, and knowing where to take, like, knowing where those, how do I refer with consent appropriately to make sure they're connected. So through like family justice centers, knowing, through other areas. And then for the short-term trauma therapy, since I'm talking, Dr. Nienow, I can add this. Majority is the age group. It depends. It's on the modality, but I think that it can be pretty young. It just depends on the disclosure or concern. So Dr. Nienow, do you want to take that one?
Sure. CFTSI, that dyadic therapy model that we were talking about, the acute trauma therapy, that is 7 and older, and it has to be a caregiver who has had involvement with a child for at least 6 months. So we can have children use a foster parent, for example, or a grandparent who's had guardianship, as long as they know the child for like a prolonged period of time. So there are some specific kind of requirements for that therapy model specifically, but otherwise we can refer them to other trauma therapy models, and there's really no age limit. The Chadwick Center has a Kid Start program, which is early infant mental health, and that's from age 0 to 5. And then trauma counseling also bridges some of that, and they do both early childhood as well as adolescent trauma therapy. And then to answer the question about kids in a residence during an IPV event, yes, the children are included in the crime report, and law enforcement cross reports also to Child Protective Services. So they are eligible for services. That's one of the ways we're also trying to expand the victim witness protocol, is to have all victims or witnesses, sorry, to domestic violence events have forensic interviews and access the CAC system for that trauma therapy specifically, since witnessing violence in your household is one of those really significant ACEs that has long-term negative health effects. We want to get those kids plugged into service.
It looks like the next question is just around how to request a speaker. So if either of you have any preferred methods to make speaker requests, that's one of the next questions in line here.
I'm email. I don't know, Michelle, is that your preferred?
Yeah, that'll be, if it's coming through the committee, I'm not sure if it's Tara or Sarah, if you want to filter those to us or directly to us, either way.
And I presume that when you're asking about a senior for a forensic exam, you mean a like elderly individual and not a senior in high school. And I will punt that to Michelle, who's an adult provider. I don't do adults really.
Yeah, and I think that for a senior, I mean, again, those are the nuances are to call, because they still will have to be reported. It doesn't necessarily mean that law enforcement will not, that it has to go through them, but it's definitely something that the senior has to have the ability to consent, or, you know, they would work that out with the nurse. So if they are, don't, you know, we would go through kind of that unique situation with them, but knowing that these are not anonymous. Like I want to be very clear about that in the medical space. These types of exams, like for sexual abuse, are something we could conduct and hold certain information, but the kit, the exam itself, these all have to be reported. So just, you know, the senior, my suggestion would be to one safe place, you're safe, you someone walk, maybe starting even there if there's additional services, and then they can connect or call the nurse, and they can kind of help determine what those next pathways would be. And Dr. Nienow, I think you want to echo that. Like this is not something that medical has. We don't have anonymous services. They still have to be reported.
Also California law that all crimes, so sexual assault being one of those crimes, be reported to law enforcement. There are safeguards put into place so that victims don't have to continue the legal process. So we can obtain a kit and it doesn't have to go through the legal process. People can say, I don't want my kit tested. So there's ways that we can get our mandated report done, but still have the victim not have to engage in that legal process. I don't know that I understand the next question. So Karina, you are asking a question about getting an expert involved. An expert in what regard? So somebody like a forensic interviewer, if that's the question, then we always want the person who receives the disclosure to make the report to law enforcement and or child welfare services. And that starts the whole ball rolling, and that's how the experts get involved. I think that may be what you're asking with that question. I just want to make sure that I'm interpreting it correctly.
Yeah.
Okay, perfect. Thanks,
Confirm.
Karina.
Great. Are there any other questions for either of our panelists here today? We do have about 20 minutes left for any additional Q&A. One more. So law enforcement always has to be involved. And I think you did touch on this, but if you'd just be willing to sort of reiterate that, what level of involvement and what maybe some opportunities for those safeguards that you referenced. So the difference between getting law enforcement involved versus continuing down that law enforcement and criminal justice pathway.
So I can touch on the pediatric side and then Michelle can take the adult side because that's a little bit different. So for our kids, with law enforcement is always involved as they have to authorize us getting DNA forensic evidence collection. Also, any violence against a child is reportable by state law. So what I will say is for like younger kids who are not of age of consent, they don't get to decide whether or not criminal prosecution happens. When you have to have a victim engaged in going through the criminal process, so let's just say we have like similar aged peer sexual assault, the victim can choose not to move forward with prosecution because law enforcement needs them in order to move forward, and they can decide along with their advocates not to do that, and that is completely okay, and then that won't move forward. And then from an adult side, Michelle, there's different safeguards that are in place for adults.
Yeah, and I think that no matter where you are in the medical setting, no matter what, if you have a suspicion of assaultive or abusive conduct, right, that falls under the medical mandated reporting statute, at minimum, you have to make a phone call to law enforcement if you're aware of that, as well as submit a suspicious injury report. So those are the minimal thresholds where if you're aware as a medical mandated reporter of an event against a child, a vulnerable person, or something that qualifies under the 11160, 11161 code, we have minimum standards that we have to report. So to the level of law enforcement involvement, that is a minimum threshold for those that are licensed in the state of California. But as far as an engagement, right, for these exams, for adults, that's why we have what's called the non-participating report for adult sexual assault exams, that if they are within the 120 hours and they would like to have a forensic exam, if it's related to sexual assault, we will provide them care and services and collect the evidence. We still have to make our minimum report. We still have to have a case number that is tied, but that person does not have to engage with law enforcement. So again, it doesn't mean it's not reported, because, and that's part of the consent process that we talk about with patients. If there's a senior or an elder that would like to have an exam, they may fall under the vulnerable population similar to a child, right? So again, whereas they may be able to have an exam, but it doesn't necessarily mean that it won't be reviewed or investigated if it's an elder or dependent. So there's protectives of level of participation, and then there's a minimal threshold of what has to be reported when you're a medical provider. So again, these cases are intended to document injury as a result, or document the history and the medical around something that might have happened to someone. So that report would, most people that want to have this exam the report goes through the process, right? And then the next steps would be level of engagement. I don't know if that helps answer the question, but it really is. Law enforcement doesn't have to say yes or no to the exam, but we can't hold minimum information from them. It'll always have to be reported at least on a 920 suspicious injury.
And there are good reasons for this, especially in child sexual abuse cases. Predators or pedophiles specifically have multiple victims associated with them. So for every one child who makes a disclosure, there are usually 20 other child victims that haven't disclosed. So reporting is imperative not only for the health and well-being of the child who's involved in the current case, but also the overall health and safety of the community at large, because so many of these cases go undisclosed, and it's a significant risk to children. So there are good reasons that these have to be reported, so that we can keep kids healthy and safe. And that's why we have a really well-controlled and well-managed process within the forensic community about how to respond to that in a supportive and trauma-informed and developmentally appropriate way, because we want victims to be able to feel as supported as possible and not like they're being forced into taking part in something. What we're really trying to do is get them from that victim state to the survivor state, and minimize all of the trauma in between there. So.
Thank you. And there was one more question that came in around resources, services for adults. Are there adult trauma therapy groups available for victims of sexual assault? Specifically through these facilities that we've been chatting about today.
Yeah, so those, there is trauma therapy available. That would happen with the consultation of a clinician, determining if it was an individual or a group, depending on the need. So we would refer over to our trauma therapy department, or somebody would be able to, through One Safe Place and other advocacy agencies, would be able to determine if there is availability. So yes, they are available in different parts of the county. They're available through our program, as well as I think some of our partner programs.
Fantastic.
And so I will just reiterate, this is, I think, the nuances and complications that can happen within these types of services. This is really important of why centralized services, and knowing that we're a partner through the Rady Children's and the Palomar Health program. And when in doubt, it's a lot, right, to remember, right, Dr. Nienow, would be to call. Just call. We are available to help. You don't have to have all the answers, but know you have a partner and a resource available at your fingertips.
Wonderful. Thank you so much. Oh, it looks like we were just about to wrap up, but just wanted to add a note from Tara Marikine here. She said for adult SA survivors, you can refer to the Trauma Recovery Center at One Safe Place and Your Safe Place. Center for Community Solutions and Women's Resource Center may also have treatments available. So yeah, trying to get them in touch with some of those multidisciplinary organizations. We certainly don't want to take more of your time than we need to, but we're so grateful for the recap. Obviously, there was a lot of information and clarity that you were able to provide in such a short time together today. And I just want to give the floor back over to Tara Marikine if there's sort of any final wrap up, just a reminder of when those certificates are going out you'd like to share.
Yeah, thank you again to our speakers for taking the time with us today. Very useful information. I will be sending out all of those resource links as a follow-up in the email. and you will get your certificate of attendance within the next week or so. Thank you again, Dr. Nienow and Michelle, for being here with us today. All right, thanks.
Thank you so much.
Thanks, everyone.